Femoral stress fractures can occur anywhere along the femur. Common sites include the medial, posterior medial proximal shaft, medial cortex of the midshaft, the distal femur, but the most common spot is that femoral neck. The mechanism of injury is going to be weight-bearing DIF. Signs and symptoms for this type of stress fracture are going to be similar to what you would see in any other type of stress fracture, in that you have generalized vague pain. In this case, it'll be at the thigh during weight-bearing activities. You'll notice that there's pain with the affected leg dangling over the edge of the table. There will be resting or night pain. There will be groin pain that is symptomatic of femoral neck stress fractures and a painful gait. Range of motion tends to be within normal limits for both hip and knee active and passive range of motion. Special tests that you can perform include the fulcrum test, which simply involves putting a fist under the femur and applying pressure to that distal femur. And oftentimes the seated leg crossover will hurt in the hip itself if there is a femoral neck fracture. During manual muscle testing, you'll notice weak and painful contractions, specifically at that stress fracture location. Diagnosis consists of an MRI, a scintigram, or the gold standard bone scan.